You're welcome. All right, good afternoon, everyone. You're welcome. Please, if you can hear me, today will be a wonderful live session. Please tell everyone. If you know somebody that will benefit from this live session, please start informing them so that they can join us and start enjoying and experiencing wellness, because today's topic is going to be wonderful. Good afternoon once again. Okay. Good afternoon once more. So if you can hear me right now, please share this live so that everyone can enjoy and benefit from this session. While we are waiting for the doctor to join us for an amazing topic we have here today. You are welcome. Anuwa Miri, you are welcome. Good afternoon. Yaogundi Monsistin, good afternoon to you too. So if you can hear me, please, can you please do me the honor of dropping your location where you are joining us from? If you are from Lagos, you can drop Lagos. If you are from Port Harcourt, you can drop Port Harcourt. If you are from UK, you can say I'm from UK. I'm joining us from UK. If you are joining us from Canada, you can say you're joining us from Canada. At Dioriolo, you're welcome. I am Jola Olua, you're also welcome. Okay, you're also welcome. Oh, that's wonderful. From Ogun State, you're welcome. Okay, now we are waiting for our doctor to join. Anyo DC Ray, you're welcome also. You're welcome. Squirrel, you're welcome. So, okay. Jola Olua is joining us from Ogun State. Thank you. Just make sure that you share this live. We are talking about a particular topic that has affected lots and lots of people, and I know that the information shared today, that will be shared today, will be valuable to everybody. So make sure you share it to your friend, tell everybody to join us. You can see the share button, the corner, as in on that down below. You can share it to everybody so that nobody will miss. Good afternoon to you too. That's B Day Me. Good afternoon to you too. Good afternoon. So before the doctor join us, so let me talk about what we do at Teledoc. So at Teledoc, what we basically do is we connect a doctor to you. You understand? So we connect a doctor to you. For example, if you're a person, you're feeling, you feel that you need to speak to a doctor, instead of you dressing up, running, kitty to an hospital to seek medical assistance, Teledoc is there. You can just pick your phone, log into your phone, search any doctor you like, because on Teledoc we have over 1,000 plus doctors. That's amazing. The pool that you can choose from. So you can just search for any doctor you want, any doctor. Now you search them, you check the time that is very, very convenient for you, and you book a consultation, and that's it. Very easy. Just book a consultation. Some people will be like, okay, I need a doctor for my children, so that's why Teledoc is also there. We have pediatrician, that's doctor that deal with children. We have dermatologists, doctor that deal with skin. We have dentists, teeth doctor. We have eye doctor, that's optician on the Teledoc app. If you are the type you are looking for a fertility consultant, you want to talk about gynecology, also, you can, from your phone, you can always search for a fertility consultant and book a doctor from your phone. Very easy, very easy. So I am Jola Oluwa. You said I still don't know how to chat a doctor. So now okay, that's a very, so let me just talk about that before our doctor join us. So let me talk about that. So on Teledoc app, when you open Teledoc app, what you will see is you will see the interface, you will see doctors. You can just click on the search icon, you will see all the doctors available. Just choose any doctor you want, and it is not chat, it is video consultation. As you are seeing me now, that's how you'll be seeing a doctor when you are consulting with them. So you'll be seeing them, you can chat with them, face to face. You see their face, and at the end of those consultation, they can write prescription for you. You get they can write prescriptions for you. So, and also when they write prescription for you, you can always take that prescription, what they write for you, you can always take it to the pharmacist. If they request for lab test, you can always take that to get a lab test and re-upload, and for doctor to interpret for you. So if you can hear me, that's Teledoc backend. Please just let me notify the doctor that we are still waiting for our doctor to join us. We are still waiting for doctor to join us. So okay. So if you still have any question, for Teledoc, like you are trying to book a doctor, all those questions, you can just drop it here while I answer them before the doctor arrive and we start today's session. So if you have any question concerning booking, how you can book a doctor, concerning the kind of and the wide array of specialists that we have on Teledoc. As I was talking about the other time, I talk about we have some consultant, that's children doctor, that's pediatrician, they are on Teledoc. We have dermatologist, doctor that deal with skin. Some people, they will have something on their skin, they'll be like, what is wrong with my skin? Okay, what can I use to make my skin better, glowing? So you can always consult a dermatologist on Teledoc. And also for dentists, some people, they have issues with their teeth. Some, let's talk about mouth odor. Some want to, make their teeth better. Some have, some teeth are not properly aligned. You can always consult a dentist on Teledoc app. Also, talking about oncologists, doctors that talk about, deals with, cancer. Okay, that's oncologists. You can always find them on the Teledoc app also. So I'm still waiting for doctor to join us so that we can start today's live session. So I'm still expecting you to still, if you have any question concerning Teledoc while we are waiting for doctor, so that I can answer them. Lima Cake and Treat said, I've requested to join. No, we are waiting for doctor. So here, like a day like today, we invite doctors on our platform to come and share a topic that will benefit us, or so that all of us can be benefited. So that's what we are doing today. We are doing health talk, and today we have a doctor that is going to talk to us about myeloma. What myeloma means, you can also call it blood cancer. So we are expecting a doctor to join us shortly. So you will still join us. So just in a minute, let me reach out to Dr. Kelechi or Oderigbo to join us. Okay. I'm still waiting for your questions. So if you have a question about Teledoc, about the app, about how you can book a doctor, just drop it for me while I answer all of them. Okay. Olawumi, Olawumi Nikki said, we have been having body pain and also my throat has been paining me since 5 years ago. So all these questions, see, now that's what I've been saying. So Teledoc, we create a platform for doctors to consult with their patients. We are not an hospital, but on Teledoc app, you can always, you can always book a doctor. And like this program, like this, you can always, as a program like this, you can always consult with and ask a question from the guests that we bring to this program. So so if you still need further question and further clarity, just download Teledoc app, just search a doctor, and just book a consultation with them as soon as possible. Ayomide Ayo, I also, so I can see you. Ayomide, you're welcome. Okay. Dr. Casey, so Dr. Kelechi, if you can hear me, so you can join us. I've sent an invite to you. So, okay.
Hello? Hello?
Yeah, I can see you now, sir.
Hello, can you hear me?
I can see you and I can hear you, Dr. Kelechi. Can you hear me?
Yes, I can hear you very clearly.
Okay, good. So, you're welcome to our Instagram live.
Okay.
Our Instagram is sponsored by Teledoc, as you know, and also Teledoc Foundation. And right now, I'm your host, Oluwatimilen Farino, and with me, I have with me here is Dr. Kelechi Oderigbo. I don't know if I get the pronunciation right, Doctor.
Yeah,
I
you
don't
did.
know. Did I get it right?
Yes, you did.
Or,
Hello?
can you hear me?
Yes, I
Can
can
you
hear
hear me?
you.
Okay, so I said, did I get the pronunciation right? I said I'm
Yes,
live with Dr. Kelechi Oderigbo. Okay. So
yes.
Before you came, before you join us now, so I've been talking about what we'll do at Teledoc that will connect you to a doctor, will connect, people that need medical help to a doctor. So on Teledoc, we have doctors like Dr. Kelechi here that people can always consult with, you know, and they get their problem solved after the consultation. So today we'll be talking about an interesting topic today. That's we are talking about multiple myeloma or blood cancer. So before we dive into that topic, so let me allow my doctor to properly introduce himself. Over to you, Dr. Kelechi.
Okay, good everyone. My name is Dr. Kelechi Oderigbo. A general practitioner currently working in Mikio Cancer Center, Nigeria. And today we are going to be discussing multiple myeloma.
Okay, good. Thank you so much for the brief introduction, sir. So let's dive into the topic. So, make us understand what when we are talking about myeloma, what is myeloma for people
All
at
right.
home, for people listening, for all of us to really understand what the topic is. Over to you.
All right, I'm going to make sure I break it down to the understanding of everyone with simple terms and avoid a lot of medical jargon. Multiple myeloma is simply cancer of the plasma cells. Now, what are plasma cells? Plasma cells are actually one of the components of blood cells that is responsible for production of antibodies for long-term immunity. Now, the human blood has four major blood cells produced in the bone marrow. They include the white blood cells, the red blood cells, the platelets, and the plasma cells. They are all produced in the bone marrow. The function of the red blood cell is for transportation of oxygen. The function of the white blood cells is to serve as a first-line defense against infection. The function of the platelets is to stop bleeding, and the function of the plasma cells is to produce antibodies for long-lasting immunities. Now, each of these cells can be affected by cancer. Cancer of the white blood cell is called leukemia. Cancer of the red blood cell is called polycythemia vera. Cancer of the platelet is called essential thrombocythemia. And then cancer of the plasma cell is called multiple myeloma. And that is exactly what we are actually discussing today. Multiple myeloma, which is cancer of the plasma cells, which is one of the components of the major blood cells in the human body.
Thank you so much. That was very insightful. So we've talked about what multiple myeloma is. You said it is the cancer of the plasma. Like, am I right?
Yes, the
Yeah. So
plasma cells.
let's talk about the patients that have that condition. How do a person know that the person is suffering from multiple myeloma?
All right. So sometimes multiple myeloma is discovered from routine screening. The patient just steps into the hospital and decides to do the normal screening test, and the easiest one to do is full blood count. When you do this full blood count, you discover that your white blood cells are low, your red blood cells are low, and your platelets are low, and you don't know where this is coming from. It's most likely that the patient might have come down with multiple myeloma. The reason is because the cancerous plasma cells, they will displace other hemopoietic stem cells like the red blood cells, the white blood cells, and the platelets. That's why they are low. Some other times, for patients that don't usually do routine checkup, all of a sudden the patient might start having some pains in the back, in the lower back. The patient might start having some abnormalities like swollen legs. which is a feature in keeping with renal system affectation. The patient might start coming down with recurrent chest infections, which is usually in keeping with hematologic manifestations when the white blood cells are displaced. The patient might start having something we call purpura or petechia on the skin, which is actually a sign that the plasmas are low. So when the patient start having these abnormalities like bone pains and the likes, the patient might further need to be evaluated, and then the patient might know that he or she has come down with multiple myeloma, including weight loss.
Okay, so before we continue, so if you can hear me right now, I am live with Dr. Kelechi Oderigbo, and we are talking about multiple myeloma. So please just help me to share this live so that everybody can benefit from this topic that we're talking about. You know, a lot of people out there are suffering from it and they don't even know that they are suffering from it. So today, this is like an awareness so that, you know, so it's good to just, you know, push this out and so that a lot of people can benefit from this. And that's the reason why we have a doctor here, a doctor that's, you know, that has, you know, done this and treated this condition, a doctor that knows its onions. So that's the reason why we have this live session. So, doctor, you've talked about um, the symptoms. You talk about they will have low back pain. You talk about when they have to do, is it full blood count or white blood cell test, right?
So when you do full blood count, you see the white blood
Okay.
cell count, you see the platelet count, and then you also see the red blood cell count. When these parameters are low, it means that something is actually displacing them in the bone marrow. And that is the abnormal plasma cells that are cancerous that are actually displacing them from your full blood count.
Okay, so what I want to ask is, it is not common for a person to just walk into the hospital and say that I want to have my, full blood count and this and that without, first of all, noticing some certain symptom in the body. You know, how can you talk about pain in the back? What other thing, like, is it what other build up can just point us to the fact that, okay, for a person to just be triggered and say, okay, I want to go to the hospital to do this test. You know, a lot of people might just think that, okay, this thing is maybe related to some other condition, not knowing that it is multiple myeloma. So can you please just explain it further, sir?
All right, there are some clinical features at which you are going to find in patient that has multiple myeloma. First, the patient might start losing weight, and then there are skeletal system manifestations. Skeletal system manifestation, as I said initially, it includes bone pains, which could be due to pathologic fracture. The bone might just stay and break because of those abnormal plasma cells in the bone. Then the patient might start experiencing back pains, lower back pains. The patient might start experiencing pains in his or her ribs. That's the skeletal manifestation. Then the patient might have some hematological manifestation, like recurrent chest infection, if the white blood cells are displaced, including fever. The patient might also see that he or she is becoming pale, a condition we call pallor in medicine, and extremely weak, which we call fatigue, and is due to anemia, low red blood cells. And the patient might start bleeding easily because the platelets are actually displaced. And the patient might have some marks in his or her body as if there is bleeding underneath the skin, which is known as petechia and purpura. Then the kidneys might also be affected, at which the patient might start discovering that the legs are swollen, which we call pedal edema. The patient will find it difficult to make urine, which we call anuria. And the patient might discover that the blood pressure is going up, which we call hypertension, and fluid might start accumulating in the lungs, causing breathlessness. So if the patient starts experiencing these symptoms, the patient will know that there is a problem. The nervous system can also be affected, and it occurs when the spine is affected, which will lead to spine compression. When the spines are compressed, the patient will be having limb weakness and difficulty in walking and some other spinal deformities. So when the patient starts experiencing this group of signs and symptoms, the patient should know that there is a problem that needs to be evaluated, which might be multiple myeloma.
Oh, thank you so much for that answer, sir. So, if you have any question regarding multiple myeloma, you can just drop it in the comments. When we finish this live, doctor will answer all those questions. So, we've been discussing about multiple myeloma, which is the cancer of the blood plasma, right? Am I right, doctor?
Yes, sir.
So which is the cancer of the blood plasma or cancer of the blood or something. So if you have any question regarding that for Dr. Kelechi, please just drop it in the comments. So doctor, let's talk about what causes multiple myeloma. Is it food we take? Is it the lifestyle? Is it related to genetics? So over to you, doctor.
All right. The precise cause of multiple myeloma is unknown, although there are risk factors that could predispose one to multiple myeloma, like the gene of the patient, age group older than 60 years old. People that are older than 60 years old, they are at risk of multiple myeloma. Environmental and occupational causes like herbicides, like insecticides, petroleum products, all those stuff put you at risk. If you are working in an environment where those things are being used, or in your environment that drain oil, petroleum products, and the rest, or you're working in a farm where you use herbicides to actually kill insects in the farm, you are actually at risk of multiple myeloma, including those that are exposed to radiation. After the atomic
Okay,
bomb that
sir.
was dropped in Hiroshima, you discover that most people, after some years, they came down with multiple myeloma because they were exposed to high level of radiation. And then it also runs in families, okay? But it's not everybody in the family that will definitely come down with it. So that's why it's a risk factor. These are the risk factors of multiple myeloma.
Thank you so much for that, doctor. So before we go into maybe lifestyle modification, how a person that's have this condition, how they can adjust to their lifestyle, and also to to prevent it. Dr. Kelechi is a doctor and that is available for consultation on the TeleDoc app. Like you can see us right now. That's the same way you'll be looking at Dr. Kelechi, and you can book in for one-on-one session, like this, you know, discuss any medical condition that you want to discuss. Personally, it is secure, it is safe, your information is secure and private, and your medical record also is safe and secure. So you can have one-on-one chat with Dr. Kelechi, talk about any medical condition you want to discuss. If you need a prescription, they'll put it down for you. If you need to buy medicine, they put it down in which you can take it to the pharmacy to get medication. Is available. You can just search for his name, Dr. Kelechi Oderigbo on TeleDoc. Check for his available calendar and also the time that you two that you are free and you are convenient and just have one-on-one session. So now let's dive into how can we, I won't say prevention, because you said the cause of this condition is not really known. So let's talk about how we can, lifestyle modification. What can we do to manage? Or let me still say, if there's anything to prevent also, on how, or also let's talk about the treatment. So I asked a question now. So we talk about lifestyle modification. and also we'll go out to the treatment. Over to you, doctor.
All right. So there are some things that one can do. There are some modifiable risk factors and non-modifiable risk factors. Those ones that are non-modifiable include age. There's nothing you can do about growing old. Definitely you will grow old. Those ones are non-modifiable. Then family history. There's really nothing you can do if you are born in a family at which that illness runs. Then the gene of the patient, there's actually nothing you can do to if you're genetically predisposed to this condition. But there are some modifiable risk factors like environmental and occupational causes, reduced exposure to herbicides, reduced exposure to insecticides, reduced exposure to petroleum products, reduced exposure to high level of radiation. So these are the possible ways at which you can actually prevent it. Then for the treatment, multiple myeloma is usually managed by the doctor of the blood, and the doctor of the blood is called a hematologist. Although it is also managed by a multidisciplinary team, apart from the hematologist, there are multidisciplinary team that needs to that needs to get involved in the management of multiple myeloma. And that team will include an oncologist, which is a doctor of cancer. It includes a psychologist, which is a doctor of the mind. It includes a physiotherapist, which is a doctor that aids in exercise. It includes an occupational therapist, a dentist, doctor of the teeth. It includes a critical care physician, a doctor that's in charge if patients are extremely ill, and then a palliative care physician, a doctor that can actually aid you in the end of your life. So these doctors need to come together in management of this illness. So the treatment is dependent on the age of the patient, the stage of the disease, the prognosis of the disease, and the comorbidities that have arisen on the course of this illness. So we usually give bone strengthening injection for those who have bone pains and at risk of fracture. And those bone strengthening injection include Zoladex and denosumab. We can also transfuse or give erythropoietin for patients whose blood level are low. Then there's a combination of both chemotherapy, immunotherapy, and corticosteroids written in regimens that can actually be used to treat multiple myeloma. Also, there's what we call stem cell transplant, at which is the bone cell of the individual will be taken out and then retransplanted back to that individual, a process known as autologous stem cell transplant that also aids in treatment of multiple myeloma. Then we can give some other aids like radiotherapy, which is usually given when there is bone pains. The surgery is reserved for patients that come down with pathologic fracture or spinal cord compression. For those that come down with infection, broad spectrum antibiotics can be given. Then other painkillers like paracetamol and codeine can be prescribed for those with bone pains. There's what we call hyperviscosity syndrome due to excessive abnormal proteins in the blood. When that occurs, we can do what we call exchange blood transfusion, at which we remove those abnormal blood from the patient and then transfuse with a blood that is not infected with multiple myeloma. Then if the white blood cells are low, we can give filgrastim. If the platelets are low, we can give platelet concentrate. The patients that have come down with kidney issues due to affectation of the kidney by these multiple abnormal cells that are multiple myeloma, we can do what we call rehydration, give diuretics, and then place the patient on hemodialysis in order to aid in removal of this abnormal blood. Then immunizations like influenza vaccines and pneumococcal vaccines can also be given. And then if a patient comes down with depression, we can call the psychologist to come and aid in that. And then the patient also needs some supportive groups, and then teach the patient how to identify the symptoms of multiple myeloma, the side effects of the medication, and then importance of balanced diet, maintaining adequate hydration, supportive care, and palliative care should also be discussed with this patient. So these are the methods that we should use in management of multiple myeloma.
Hello, can you hear me, sir?
Yes, I can hear you. Hello, can you hear me?
Okay, good. Thank you so much thank you so much for that. So uh, if you can you hear me, sir? Sorry.
Yes, I can hear you.
Okay, so we have some people they're already dropping comment that okay, they would like to book like Sanusi says that I would like to book appointments for hyperthyroidism. So can always book doctor at the end of this program. Just log in into PediDoc app and search his name and book a one-on-one appointment with him. So Sugar K says, what is the cost of what's the cause of chest to back pain? So that's a question. So if you still have any question relating to multiple, you can still drop it. Over to you, doctor. That's a question from one of our viewers.
All right. So multiple myeloma, as I say, it usually affects the bones. And the bones that are affected are usually long bones of the arm. Then it can affect the bone of the spine. It can affect the pelvic bone too. So when the bone of the spine, the lumbar section of the bones are affected by this abnormal plasma cell, it causes back pains. When the bones of the pelvis is affected, it will cause that waist pain. So the patient will be experiencing pains around that region. And if nothing is being done about that, there can be spinal decompression, spinal compression that would actually require surgery to actually relieve that pain. Arises. Sorry about that. Can you hear me? Hello, can you hear me? Hello, I hope you can hear me very clearly. Hello, hello,
Hello,
can
I
you
can
hear
hear you
me?
clearly, doctor. I
Okay,
can hear you clearly.
yes, I said when such bones arises, we usually give painkillers like codeine and we usually give paracetamol. Now, there are some painkillers that should be avoided, like the NSAIDs. The reason why they should be avoided is that they are not renal friendly. They cause renal toxicity. NSAIDs include ibuprofen and diclofenac, and those in that class, they should be avoided. If the pain cannot be controlled by painkillers, the patient will be sent for radiotherapy. Radiotherapy will really help to control the pain. And then those that have come down with spinal issues, they might need spinal decompression surgery to actually take care of the pains.
Okay. Doctor, if you can still hear me, so I want you to just round the whole thing up by giving us a final word for anybody listening out there. They have somebody that is passing through this, and a word, that when they hear it, they will know what to do, sir.
All right, multiple myeloma is a plasma cell cancer that affects individuals of all race. So both the black man suffers for this and the white man suffers for this. It is more in males than in females and more in blacks than in whites. Currently, there is no known cause of multiple myeloma and there is no preventive measure for multiple myeloma. And unfortunately, it has no permanent cure, although it's a manageable illness. The commonest cause of death in multiple myeloma is infection, and management of multiple myeloma requires a multidisciplinary team that includes a hematologist, an oncologist, a dietitian, an occupational therapist, a psychologist, and all these teams that are needed in management of this condition. And unfortunately, survival rate ranges between few weeks to over 20 years, depending on how quickly this illness is detected. And even during treatment, there's what we call relapse. It can come back again after treatment for a very long time. And it can get to an end stage at which treatment will no longer, at which patient will no longer be responding to treatment. Survival is higher among the younger age group and is lowest among the elderly. And the key factors of the prognosis of this illness include the tumor burden, the advanced stage of this illness, and the rate of proliferation. So that is a summary of multiple myeloma.
All right. Thank you so much for this enlightening session. We really appreciate your presence on our live today. So to you out there as you are listening, if you do, I was also saying thank you, Doctor. So his name is coming up. Please, his name is Dr. Kelechi Oderigbo. You can see the pin name on this live. Kelechi, just type Kelechi Oderigbo. Just type it there. You will see on in the search column. Just search his name, and when you search his name, you will see his calendar. Just book one of his available time and book him. And also, if you still have an issue, just chat us, on Instagram, or you can search for our support inside the app. You can just chat us. We will respond and we will connect you to Dr. Kelechi Oderigbo. So thank you we're saying thank you to everyone. We're saying thank you to our viewers. Till we'll meet again next time. My name still remains Oluwatimilayo Farino. And take this home health is wealth. Take care and bye-bye.